Hello, you're welcome to my platform. I am Dr. Sandra Nabukalu and I am a surgeon. I hope you become aware and sensitized about the different surgical conditions. Today's video is about melanotic ulcers. Melanotic ulcers originate from a pre-existing melanoma lesion. Melanoma is a cancer of the cells of your body called melanocytes. Melanocytes are responsible for the production of melanin. Melanin is a pigment, a substance, a chemical that is responsible for the color of your skin, eyes, and hair. The higher the concentrations of melanin produced by your melanocytes, the darker your hair, your eyes, and skin. Melanomas are usually the precursor of melanotic ulcers. That is, in order for you to end up with melanotic ulcers, you must always have a pre-existing melanoma lesion. Melanomas usually result from damage to the DNA of the melanocytes. That is, as a result of prolonged exposure to the ultraviolet radiations from the sun or tanning beds. For example, you want to turn the color of your skin to a darker color. You might end up causing damage to the DNA of the melanocytes. DNA, by the way, is a molecule that is found within the cells of your body, in this context, melanocytes. DNA contains the information that is required for the growth, development, and functioning of your cells. When DNA has been damaged, even the information within the DNA gets damaged. And so, the cells are going to receive abnormal, defective information concerning growth, function, and development. They will, for example, receive information that they should grow at a faster rate. They should grow, multiply at a faster rate. And so, the cells are going to grow at a very high speed, and we shall end up with clumping of cells together, and we form a mass, we form a swelling, a tumor. In this context, a melanoma. After some time, when the melanoma grows in size, the topmost layer of the skin will become evaded, and then it will give way, become eroded, and then we form an ulcer, the melanotic ulcer. The risk factors that predispose one to developing a melanotic ulcer include prolonged exposure to the sun or using tanning beds, family history of skin cancers or melanomas, personal history of skin cancers or melanomas, patients that have a lighter complexion, for example, the whites, patients that have a lighter color of the hair, for example, they are blondes or they have red hair, patients that have freckles, patients that have moles, especially in large numbers or in larger sizes, for example, more than 6 millimeters. Patients that have immunocompromisation for some reason, maybe they have HIV, they have diabetes mellitus, or they are on anti-rejection drugs or steroids or cancer medications. Females are also at a higher risk. The following are the warning signs that you should look out for when it comes to melanotic ulcers or melanomas. Because remember, you will not have melanotic ulcers without melanomas in place. Please examine your body, your skin, from head to toe, looking out for any skin lesions on your body, any moles on your body. And if you have had any pre-existing skin lesions, please look out for any changes. For example, look out for changes in color, size, shape, Please look out for any changes in symptoms. For example, itching, bleeding, ulceration, or crusting. And we usually have an acronym for the things that you should look out for if you have seen any of the lesions. For example, you have seen moles or any skin lesions on your body. And the acronym is the ABCDEs of melanomas. Because remember, you cannot have melanotic ulcers without melanomas. It is always a precursor. Please look out for asymmetry. Asymmetry just means unequal. When you draw a line through the middle of the lesion that you have seen on your skin, the two halves are always going to be unequal if it is a melanoma. If you see that, please just come to the hospital, because it can actually be that you have a melanoma which is at an early stage and can easily be managed by a simple surgery. The other thing that you should look out for is the borders of the lesion. The border of a melanoma is usually rugged, not smooth, irregular. Unlike for just an innocent, benign mole on your skin, for it, the melanomas are always going to have rugged borders. And for the moles, they usually have smooth borders. But if you have a melanoma, it is usually going to have rugged edges, rugged borders. The outline of the lesion will not be smooth. It will be rugged, irregular, not smooth. Please look at the color. If it is a melanoma, they usually have different colors, different shades of colors. For example, maybe it will be brown, but at some point some part of it will have a lighter shade of brown, or it will be black and then a certain part of it will have a lighter shade of black. It will even have so many different shades of the color, the original color. For example, it will be on a continuum of black or on a continuum of the shades of brown. At some point, it will even turn to white, to red, even blue. Please look out for that. If you see those changes, just know it is a melanoma. Please come to the hospital, because melanomas are very aggressive. If you leave them to grow for a long time, they can easily go to the lymph nodes, they can easily go to the other organs of your body via the blood. Please look out for the diameter of the lesion on your skin that you have seen on examination, and also look out for the darkness. When it comes to the diameter, if the lesion is more than 6 millimeters, that is a very bad sign. It can point to a possibility of a melanoma. And the melanomas are always darker than the surrounding moles. By the majority of the time, like I've told you, 20% of the time, melanomas come from pre-existing moles. So if you have a mole that is transforming into a melanoma, it is always going to look darker than the other moles around it. Please look out for that. So diameter and darker. More than 6 millimeters, darker than the other moles, darker than the other lesions neighboring it, surrounding it. Look out for E. E is evolving. Look out for changes. Melanomas tend to change. They tend to change in shape, size, color, even symptoms. For example, they will start itching, bleeding, crusting, or ulcerating, which does not happen in normal moles. Please look out for the E, the evolving. They evolve, they change, but in a bad way, not in a good way. The other thing that you should look out for is what we call the ugly duckling sign. The ugly duckling sign is always based on the concept that melanomas are going to be odd. They will stand out. from the rest of the lesions. For example, the moles around. They are going to stand out. They are going to look odd man out. They are going to be smaller than the surrounding moles, or even larger than the surrounding moles. Darker or lighter. They are always going to be different from the other surrounding moles. They will be ulcerated, but the others will not be ulcerated. So look out for them being different from the surrounding moles or the surrounding lesions, basing on the color, the shape, the size. Yeah, so that is the concept of the ugly duckling. They will always look odd. They will be odd man out. Also, as you examine your skin, if you see any lesion, that is also suspicious. If it is just a single lesion isolated, it is also going to be indicative that it is having a higher chance of being a melanoma. Even if it is just one lesion isolated on a normal skin. Because remember, 80% of the time, melanomas come from normal skin. Please look out for that. The inherent nature of the melanotic ulcers is that they are usually hyperpigmented. That is, they are going to look darker than the surrounding skin or the surrounding lesions majority of the time. There will also be a halo. A halo is like a ring around the lesion. There will also be enlargement of the lymph nodes, because remember that this cancerous ulcer, the melanotic ulcer, is very aggressive. It spreads very fast to the rest of the body. You can have enlargement of the lymph nodes, and majority of the time, it spreads to the liver, the lungs, the bones, and the brain. The investigations that we carry out in melanotic ulcers include edge biopsy, where we take off a sample from the edge of the ulcer, looking out for cancerous cells. And this will help us to establish a diagnosis that we have cancer going on within this lesion. And when we establish a diagnosis, we always have to stage the cancer. And the staging modalities that we use are CT scan, MRI, and PET scan. These are just imaging modalities or investigations that can easily point to how far the cancer has gone. If it has invaded the liver, the lungs, the brain, the bones. They're just investigations that will help us to know how far the cancer has gone to the rest of the body. When it comes to the management of the melanotic ulcers, we always do what we call a wide excision. And this is usually done in the early stages of the cancer, especially when the lymph nodes have not yet been affected. When the cancer has not yet spread to the lymph nodes, we always do what we call a wide excision, and this entails cutting away the entire ulcer, the entire cancer, together with 1 to 2 centimeters of the normal tissue. And after that, we can do skin grafting to cover the defect or skin flaps. During skin grafting, we always get skin, we harvest skin from the normal part of your body, for example, the thigh, and then we cover the defect. Or we use tissues around the defect to cover the gap left from the wide excision. If the cancer has spread to the lymph nodes, we can also do what we call lymph node dissection, where we cut away the lymph nodes. We also employ immunotherapy, and immunotherapy is usually employing medications that stimulate the cells of your immune system to fight off the cancer. The other treatment modality that we employ, especially in advanced cases of melanotic ulcers, is what we call the oncolytic virus therapy, where we use a virus. We can either inject it within the lesion or give it through blood. The virus will just target the cancerous cells only without damaging the normal cells of your body. The other treatment modality that we always employ, especially in advanced stages of the melanotic ulcer is the targeted therapy. Targeted therapy usually uses medications to switch off the defective sections of the DNA that are sending bad information, defective information to the cells, to the melanocytes, so that they don't continue to grow. When these sections of the DNA have been switched off, have been sabotaged, the cells will stop growing, and so the cancer can easily be eliminated. When it comes to the prevention, please always be vigilant on examining your skin monthly. Do it monthly. Inspect your skin from head to toe, looking out for any skin lesions on your skin. And if you've had pre-existing skin lesions, please look out for changes within those skin lesions. Look out for changes in color, changes in size, changes in shape, or symptoms, for example, bleeding. Look out for itching, look out for crusting, ulceration. Please always do this monthly. But it is very, very important that you visit a dermatologist for a professional skin exam. Do it, always do it once in a year, at least once in a year. And if you've had history of a melanoma, there is always a possibility of a recurrence. Please always follow up with your surgeons, with your dermatologists, so that we always follow you up and we rule out a possibility of recurrences. Or if you have any recurrences, we can always catch them earlier. Do this 3 monthly, at least for the first 3 years. 3 monthly, so that we can always examine your skin, do some investigations, looking out for any recurrences. And of course, please avoid prolonged exposure to the ultraviolet radiations, for example, from the sun. Please avoid tanning beds. Please always wear a sunscreen. If you must be out in the sun, wear a sunscreen. Wear protective clothing covering the entire body, your arms, your legs. You can always use shades. You can use a hat to shield your face from the excessive exposure to the ultraviolet radiations. Yeah, so that is what I had for you. Thank you so much for listening to me. Please share my videos and also subscribe. See you in my next video. Bye.